Yeah, it sounds very
Okay,
good, Lauren.
great. So as Meryl said, I am Lauren Behsudi. I'm with Casey Family Programs. I am in our public policy office based in Washington, D.C. And I've been with Casey for about 4 years now, doing policy work for them. So I wanted to start off by saying thank you for being here, for participating in this webinar, for your commitment to the BPNN. I know a lot of you have been here with us since the beginning, and it's just really great to see the interest and the commitment from so many fabulous parents. And also for your interest in how you can effectively influence child welfare policy. It's really important that parents are able to do this and are active, and it will make a difference. So thank you for your interest. We, as Meryl had just briefly mentioned, we have talked about policy in several of the BPNN meetings over the past year, and in August we had a webinar that was specifically about engaging and supporting parents in policy activities. Tonight we're taking it a step further to provide you with tips and information to effectively participate in a range of policy activities. Our objective remains the same, that we have parents and BPNN members that are effectively participating in a range of policy activities to inform and improve child welfare policy. As Meryl indicated, we have consulted with and talked to a number of parents in the BPNN throughout the past few months to see what kind of information is most relevant and useful to you as it relates to policy. So the information presented here tonight, much of it comes at the request of your peers, and also we're really pleased to have two of the BPNN members actually participating tonight via videos that they have prepared in advance. So we're especially grateful for the participation of Rena Moran and Denise Moore in this project tonight. And we recognize that BPNN members have a lot of experience in policy activities, and some of you may have none. So we know there's a range of experience. It's my hope tonight that at least everyone will walk away with something new or some new piece that they can take with them or some new way to think about policy. There will be an opportunity at the end of this section for questions and comments, and as always, we are very interested in hearing from you about what you want more of, less of, what kind of questions you have, and we're always interested in what kind of work you're doing. So please, if not tonight, always feel free to share with us what you're doing and what would be helpful to advance that work. In addition to the webinar tonight, which is going to be archived and available for listening on the website, we've developed some additional resources to complement the webinar, and those will be housed on the BPNN website as well. One of those resources is a frequently asked questions document that has some guidance that may be helpful for you. And finally, we're committed to helping support you if and when you're choosing to participate in policy activities. So please let us know what activities you may already be engaged in and opportunities as they arise. We're happy to help prepare you for individual activities or just help you think through how you might be most effective. Next slide, please. So what do I mean when I say public policy? Basically, we're thinking about who gets what, when, and for how long. So I'll say that again because it's a bit of a tongue twister. So public policy is who gets what, when, and for how long. And why is it important? Well, it can really drive long-term, meaningful system change. And it also can really, policies that aren't helpful can really inhibit system change and positive outcomes as well. So public policy affects the actions of child welfare agencies' staff, including child welfare practices and how services are delivered by private and state or county agencies. It can improve courts and their effectiveness And as you all know, funding is appropriated through the policy process, so that's important as well. Who is a policymaker? So when I refer to policymaker, I use this term fairly openly. We know that policymakers are elected officials, so that includes state legislators, members of Congress, mayors, governors. A policymaker is also a leader of a child welfare agency. They're county commissioners, and to a degree, they're judges as well. Policymakers make laws that direct or influence the actions of child welfare agencies and courts. They appropriate public funds and decide how these funds are invested or spent. They oversee implementation, impact, and outcomes of individual programs and the child welfare system as a whole. So what are policy activities? Again, I keep this pretty open. It's pretty much anything that helps educate and inform a policymaker about the development of policy. So this can include individual meetings with policymakers, providing testimony at a legislative hearing, participating in a town hall, participating in an ongoing advisory group or task force. Those are just a few examples of the range of activities that I include under policy activities. And when I make that reference, that's sort of the broad definition of what I'm referring to. So what can you expect tonight? We're going to share some information about how parents can effectively influence public policy. We have a couple short videos from BPNN members to help support that. And then I'm going to provide a little bit of background on government structure, child welfare history, and child welfare funding, trying to keep it very simple and sort of not too much of a flashback to school, but just brushing up on a few basics. And then we'll end with a few trends in child welfare policy at the national level. So you can see sort of in context what's sort of happening in the field right now. Next slide, please. So I'm going to go through these pretty quickly and introduce some ways that parents can effectively influence child welfare policy. These are things that we have found through our work with parents and others that have been affected by the child welfare system and our work at the federal and state policy level. There's some tips that will hopefully be helpful to you as you participate in a range of activities. So to start, keep it short and focused. Oftentimes, regardless of the activity, you'll be given a very short window of time to talk. By highlighting one or two aspects of your experience in less than 5 minutes, I always try to tell people to stick to less than 5 minutes, you can more effectively deliver a focused and concise message that your audience is more likely to remember. So one or two takeaways from your message. Next slide. So to complement that, we want to make it personal, make it real, and have a clear point. So you're an expert in your experience, and you know what you can talk about. Your personal story and your direct experience is powerful, but we also, when we're talking to a policy audience, we want to make sure that it's more than just a story, that it's helping the person you're talking to, who is influential, understand what it is that you're trying to express beyond a story. So what is it that was helpful to you that needs to be maintained and provided to other families, or what was really not helpful to you that families should not have to go through. So keep it very, without going through all the details of everything, and this sort of complements the under 5 minute rule. Keep the details relevant to the point you're trying to make. And also, you know, another piece of this is including only details that you're comfortable sharing. Many of the experiences that you may choose to talk about are very, very personal, and just be mindful about what you're comfortable sharing. Similarly, emotion and passion are important, but don't let them distract you from your message. So thinking clearly about what it is that, that you're comfortable communicating and sharing. Next slide, please. So demonstrate a range of experiences. So many voices and perspectives are needed to help improve and reform the child welfare system. Everyone had a unique experience, and we need policy that is flexible enough to fit the range of reasons and experiences that families come to the attention of child welfare. Different voices and perspectives reflective of your individual experiences are really, really critical to informing good public policy. So it's important for you to not only describe what was helpful and what worked well, if that's appropriate, but it's also, really, really important to talk about what is not so helpful or what did not work well, and to make recommendations for what would have been a better alternative. And to always, with all these areas, to talk about why, because it might not be so obvious for a policymaker to understand why that seemingly simple thing is so significant. Next slide, please. So it's all about relationships, right? So policymakers, they need people they can trust and find credible to discuss and gain support for their ideas. Relationship building with policymakers takes time and effort on your part, and it may seem one-sided for a while, but it is a very, very effective way to educate policymakers about the experiences and needs of parents and families. One simple way is to just, as you interact with policymakers, continue, always offer to be an ongoing resource. Next slide, please. So have a conversation when you meet with a policymaker. This shouldn't be a one-sided monologue. Your engagement with a policymaker should be two-sided. You can get a sense of what matters to them, where their concerns might be, and better yet, where there is alignment. And use that information as you're talking to adapt and to expand on areas that may help convince them that this is a really important thing that they need to pay attention to. Next slide, please. So all politics is local. Former Speaker of the House Tip O'Neill said this, and it's so true. Policymakers want to know what is going on in their town, their district, their state, and hearing from local constituents is very, very important. So if you're from the same area as the policymaker, same state, same town, let them know. Use this to your advantage by letting them know what your experience as a constituent in their jurisdiction was. I encourage you to really play up the hometown connection to your advantage when requesting a meeting as well. That can be really effective. Next slide, please. So if you are in a meeting or some sort of experience with someone else and you are asked a question that you don't know the answer to, it's always best to just say, I don't know, but I can try to get that information for you and follow up later. The worst thing is to guess. Next. And it also gives you an opportunity to follow up as well. Next slide. Okay. So similarly, if someone asks you a question that you don't feel comfortable answering, whether it's too personal or inappropriate, just be honest and respond that it's too personal or that you can't share any more details, and raise, again, what you are comfortable sharing. So this might seem really obvious and basic, but it's important to explain why, to maintain credibility, why you don't want to answer a very personal question. Oftentimes people don't know how personal additional details may be. Next slide, please. Know what you're walking into. So do your homework. What facts can you bring to support your points? What may have changed since your experience with the child welfare system? Has the policymaker you are meeting with been a huge supporter of your issues, or vice versa? If he or she has been, acknowledge and thank him or her for the support. Understanding what role the person plays, or where they're from, what they're most interested in, those are all things that can help you as you prepare to make a connection to your issue and make it easier for them to understand the connection and how it relates to something that they're already passionate and committed to. And we may be able to help you with this. So again, if you have some things you're working on or are invited to participate in things, please let us know if we can be helpful in doing some of this homework with you. Next slide, please. So always leave behind a fact sheet or a summary and your contact information. Leaving behind just a short one-pager of your message along with your contact information can be very helpful to policymakers. They meet with a lot of people every day, and having something tangible that they can refer back to with your contact information right there is very, very useful. One of the other tips I always like to share is always bring more copies than you think you'll need, because there are often extra staff or other participants that you may not know are going to be attending. Next slide. And on that note, value staff. Staff play an important role. They advise and help prioritize the issues that a policymaker will focus on. And they can make a huge difference by reminding their boss to focus on your issue. So if you can convince the staff that this is something that's really interesting and important, they will very likely be an advocate for you as they work day in and day out with the influential policymaker. So we need to also keep the conversation going, and this goes back to the relationship building piece. So follow up. Follow up is an important piece of it all. Send a thank you letter or email to the policymaker within a week or two at the most with any additional information you agreed to provide. Also, if things come up that you think are relevant to the conversation that you had, people are always open to additional information, is my experience. So I encourage you to follow up, and that will help as you provide timely and relevant and useful information. You're building your credibility in your relationship with an influential policymaker. Next slide, please. And finally, and this is the most important piece about talking to a policy audience. When you are talking to your story, you want to go beyond telling your story by
Welcome to GoToWebinar, Webinars Made Easy.
On what your experience may have been. You'll hear from Denise more in a little bit she's going to provide an example about one thing in her experience that made a significant difference and why it was so important to her family. Use details from your experience to specifically highlight what about the positive or negative experience was helpful or not so helpful. And when you're offering something that was not so helpful, it's always good to provide an alternative. What would have been better and why? Because I think this is what's really going to help people understand how they can help beyond just listening to a story that may be very compelling, but they might not walk away with understanding what they can do to make it better. So now I'd like to introduce Rena Moran. She is a member of the BPNN. She's also a Minnesota state legislator serving her second term, where she is vice chair of the Health and Human Services Policy Committee. She is recognized by her colleagues as a strong advocate for social and economic justice. She's also a parent leader coordinator for Prevent Child Abuse Minnesota. She describes in her video how to effectively have a visit with a state legislator, which is one of the policy activities that I mentioned earlier. You'll hear from Rena that the tips that she provides and the guidance that she provides for visits with state legislators are, many of them are what you just heard. So you can see from her how they can be applied in an effective way. So we'll move to the video now.
My name is
We're
Rena.
going to
Legislator from
we're going to
St. Paul,
restart it,
Minnesota,
everybody.
representing District
Get it from the beginning.
65A. In 2000, I arrived in St. Paul, was homeless. I'm a mother of 7 children myself, all birth parents to all 7, 4 sons and 3 daughters. And I remember coming to Minnesota, finding myself homeless and needing the support of the state, and found myself going up to the state office building. And one of the biggest impacts that I remember about that day and that moment was that I knew I had to find housing, but I knew in order to find housing, I needed a job. But I knew in order to have a job, I needed child care. In order to find child care, I knew I needed money. So I found myself in this big cycle trying to determine what do I need first. But walking to that state building, I also thought to myself, you know, how different would it be if within this building, not only did they supply you with money and food stamps, but what if they had postings of locations to find a job, locations where you could find housing, locations of who were providing child care. And it hit me at that moment that, you know, we have a system that is here to give people services, which I am a huge supporter of, having a safety net available for individuals when they need it, but also how different would it be if we had a system that was there to help and support people and lift them up out of whatever it is that they were going through. My personal experience of dealing with the child welfare system as a mother really shaped me in many, many different ways right now today. I also work with a nonprofit called Minnesota Communities Caring for Children, also known as Prevent Child Abuse Minnesota. In that position, I am the Director of Prevention Initiatives and Parent Leadership. And so part of my work is to work with parents who have utilized the system, the child welfare system and family support services, to bring their voices to that system to create better outcomes for families and communities in the state of Minnesota. And so working in that capacity in my own personal experience really shapes how I see my work as a state legislator, working to ensure that we are creating policies that are fair and just for all of us, looking at policies that not only support individuals and families, but also works to lift people up out of their situation. So for instance, we have a system, a current system in my mind, with the Department of Human Services that is a deficit-based system that really sees parents as bad parents, parents as not having enough, parents who are, you know, utilizing services. And I think if we look at the system and change that system from a deficit-based system to more of an asset-based system where we are giving parents educational training that they need, where we are supplying them with tools and research and resources that is available to give them a hand up out of poverty, I think it begins to create more families. They are creating better outcomes for themselves, but also it's creating better outcomes for children. And it really, in my mind, makes a stronger state. So everything I do looks through that lens of creating better outcomes for family and children and creating a system, a child welfare system that is really supporting the needs of families, but also create opportunities for people to be self-sufficient. Some of the advice that I can share is that your efforts are important. We need to see you here. We need to hear your stories. You are the best advocates for how a system can work and what doesn't work. So I would say just really, know that policies don't change overnight. It doesn't happen quickly. It's about building relationship with others, which I believe everything is about building good, strong relationships. And so keep that in mind, that your efforts and your stories does not go unknown, unheard, or value. It is, but also remember that we need to see you consistently, and that it's really important that you to work in coalition with other birth parents. and set up a meeting with your state legislator. You can meet in his office. A lot of times, if it's not during a session, you can meet him in your community. And I think the second way is that there's a town hall meeting. Show up and share at that town hall meeting, ask questions. And if you feel comfortable doing that, it is a great way to also have an opportunity to create that one-on-one conversation with that legislator. I believe that it's really important that when we show up, that we show up ready and prepared. And so I thought about this and I wrote down some specific tips that I hope and believe will be helpful to the birth parents as they think about going out and connecting with their legislators. So the first one is remember that legislators, you know, we're busy, especially doing sessions, and we're running from either doing session or out of session. We're running either to one committee hearing to the next committee hearing. We're meeting with tons of people. There's events. We're running from one event to another. So it's really important that you do not be upset or put off if you get 5 to 10 minutes. You know, that is quite normal. Just be prepared if that happens. Do not be upset if you are asked to talk with a staff member. Our staff members are sometimes the closest people to us. They know us. They are planning our schedule. They are just as important as we are. So don't be upset if you have to talk to a staff member. And keep in mind that sometimes the staff members are very young, but they are very diligent. They're very smart, and they will report your stories and views to their legislator. Be prepared to provide just 3 to 5 minutes of information and a longer explanation if there is time. But be prepared, kind of like a candidate. We have to do our speeches. We'll get 30 seconds. Just be prepared to have in your mind exactly what your priorities are, what you want to say, and why it is important. Make only one or two specific points about your top priorities and have some facts to support your goals. Very important. And remember, offer to be a resource to that legislator if they need more information so that they will see you as their ally and a person that can give them more information. Share your story. Stories are very, very powerful. Take the time to craft your story and share your story. But also be careful and try not to be too emotional, because a lot of times your emotion distracts from the story. If you are asked an uncomfortable question and you don't have an answer for it, say, I don't have an answer for it. And that is okay. And you may even suggest that I will get back with you at another time with an answer. And then return to your policy point. If you are asked about something and you don't know, please do not guess. It is okay. Just say you need, again, to do some research around that, and you will get back with them with the information. And try to follow up in a timely manner. And last, I will just leave with this. Once you have made that initial contact with your legislator, you shared your viewpoint, you heard from them, I would say send a thank you letter. Send a thank you letter or email. And any other follow-up requests by the legislator or offer by you should be sent in a timely manner. So really short and clear that once you have completed your meeting and you're working to build that relationship with that legislator or that staff member, follow up and say thank you for your time and your consideration. It could be an email, phone calls are always good. And continue to build that relationship and to be a resource for that legislator. So I just want to end by saying I just want to thank the Birth Parent National Network for this opportunity to share my story with you. and also help you see the power and importance of doing a legislative visit. I hope you feel comfortable. I hope that you know that the stories that you share and the perspective that you bring to your legislator into the Capitol is so important and so needed. And so I leave you with this, and that is, you are the one that we've been waiting for. You are the one that is needed to create change in your state, in your community, in your family. So take hold of it, and good luck. Thank you.
Great, thank you, and we're so grateful to Rena for providing us that video. It's a really helpful perspective. So a couple additional tips to effectively and safely share your experiences with child welfare, and I just want to point that this comes from the Casey Family Program Strategic Sharing Training and booklet. The booklet we're going to make available on the BPNN website. So you can certainly look there for some more information. But the training is usually done in a day-long training. And if you're interested in learning more about it, please contact Meryl because she can help you with that. But a couple of the components out of that training that I thought were just some additional applicable sort of areas. As you're choosing what you're going to share, be very sort of purposeful and mindful of what you want to achieve. Understand and be specific about what your purpose is, and what you would like the audience that you're speaking to do, and understand, and be intentional about what you want to share to make that point. And also, as you're doing that, consider the details that you'll share. So do they involve other people? Oftentimes these stories that affect families, they include families, so they include other people. So just be mindful about what you're sharing with others, about others that may be in your network or your family. And again, this is from the Strategic Sharing booklet and training, which is available on the BPNN website. There's plenty more information. That was just one component of it. Next slide, please. So we're going to transition now to our second video, which was produced by another BPNN member, Denise Moore. Denise is the Des Moines Service Area Parent Partner Coordinator. And she provides oversight for 15 counties in central Iowa. She is a master trainer for Building a Better Future curriculum and trains parent partners, systems, and community members both across the state and nationally on how to work more effectively with birth parents. And in this video, she is going to provide us an example of telling a component of her story to a policy audience in a focused and concise message. And so I just encourage you to listen for how she specifically identifies something that worked and talks about specifically why it worked and gives support to her story.
Okay. So we're ready, Lauren?
Yes, please. Thank you.
Hi, I'm Denise Moore. I'm the Des Moines Service Area Parent Partner Coordinator in the state of Iowa. We currently have parent partners in 68 counties across the state and are going statewide this year. Parent Partners is a program that applies mentoring services to families that have had their children removed due to child protection issues. All of our parent partners have had their children removed in the past, resolved their issues with the department, and are gone through extensive training to come back and mentor other families that are just coming into the system. We started the program in 2007. I was one of the first parents sitting around the table. We've developed and I've assisted in the development and implementation of the program locally, across the state, and nationally. I would like to talk today about my own experience with the child welfare system and how that affected me and my family. In 2003, my children were removed due to my substance abuse issues. I had been using drugs since I was around 12 years old, so approximately 25 years. And I had progressed into a point where I was selling drugs to support my habit and to support my kids fight with the finances. I was currently, at that point, I had 5 kids and I was pregnant with my 6th. I literally went to treatment, went upstairs, had my baby, and signed her over to DHS and went back down to treatment. What happened at that point was, and why I'm so blessed and what I would like to talk to you today about is the reunification services that they put into place for me. I can't state how important it is for families to stay together. My mother came into the home, and I will tell you that it was not the best situation. My mom had a past. I had been selling drugs out of the home, but I had so many kids that they let my mom come into the home and keep all my kids together. They went to the same school. They had the same coaches. They had the same teachers, friends. They knew my mom, so it was just me being removed from the situation. That was a blessing that probably saved my kids' lives. That's what I would like to talk about and how important it is to provide reunification services. It seems that as we go in farther and deeper into the system, the funding, we're allowed more services. So the funding kind of follows you as you go into the services or deeper into the system. I would like to see more funding put around keeping families together and how important that is. We have not been involved in the system since. After that, me and my children have been blessed, and we're so grateful. We've had wonderful experiences. I went to school, completed my associates, working on my bachelor's now, have this amazing career, and be able to go and travel and watch this program grow to the level where it's at today. And my children have surpassed all of my expectations. My oldest is buying his own home, and he's married, and he's having a baby, and they're going to college. I have a 19-year-old that's going to college and working his way through school to go to law school, and they've graduated from high school, and they go to church, and they are proud of their mom today and what we've accomplished. And I think as we look at what we can do for families as a person of the system, now working on the other side, I just really want to reiterate the need that we need to keep families together and at home. I have had the opportunity to work with transitioning youth as part of my job, and to see the outcomes that are coming from kids transitioning out of foster care, it hurts my heart, it breaks my heart that some of these kids are coming out. They have failed adoptions, they have no resources, they have no supports. I would be devastated if it was one of my children that was happening to. So I encourage you to really look at what we can do to keep families whole, look kind of outside the box, and think about how important it is for them to have all the same contacts and supports and family members around them during this place. In closing, I would like to say, I would like to see that families are supported from the very beginning, that we are putting more resources to keeping them together. We have a responsibility as a system to keep families together and to put them back together in better shape than what we found them. And I hope that that's what we'll take from today as I talk to you. So thank you very much for having me. I'm honored to be presenting, and thank you. How much time?
So thank you, Denise, so much for preparing that. It's just a really great example of using several of the components that I presented and really effectively sharing a component of your story and explain why it's a significant thing that you're trying, a significant point. So that was just great. So right now we're going to transition to some background information. And please, please bear with me. This is, it was hard to, I found I either needed to go provide a whole bunch of information or keep it brief. And in the interest of time, I tried to keep it on the brief side. So this is just some very basic information to just support and provide context to what we're talking about today. And also some of that sort of do your homework background type information that'll be helpful. So I'm sure everyone remembers and knows that there are different levels of government. So we have federal, state, local, tribal, community. All of these levels have important and unique roles to play, and they interact with each other in different ways. It's important to know the roles of whoever you may be talking to and their agency or their role within the policymaking process so that you are approaching your interactions with them in an appropriate way. So when it comes to child welfare, the federal government provides funds and laws and regulations and has accountability mechanisms, while states, local governments, and tribal governments administer and provide services. They also provide additional funding and set their own laws. But just understanding, and that's a very, very basic level, there's more to it than that, but just keeping in mind when you're talking to a policymaker, understanding where they are in that continuum of government and what their role and responsibilities are. Similarly, governmental power and functions rest in 3 branches. So we have the legislative, executive, and judicial branches. These are at all levels as well. And the branches operate independently of one another, but they all have a role in policy and all work very closely together. So just, again, understanding where the policymaker that you are working with may be in this, you know, where they are in the branches and who they might be closely working with as well. Next slide, please. So the federal government has set 3 official goals for child welfare: safety, permanency, and well-being. So the first goal was in child welfare was safety. And at this time, removal of children and placement into long-term foster care was really, really high. It was, you know, remove the kids at any sort of question that they may be unsafe. In 1980, Congress passed the Adoption Assistance and Child Welfare Act, and at this time, foster care was reconceptualized as a temporary service. So Congress is very intentional about foster care is not a long-term thing. Families can be reunified, and we should be treating foster care as a temporary thing. So at this time, family involvement, prevention, and permanency became elements of child welfare practice because of the policy that was set in place. And then in 1997, the Adoption and Safe Families Act further emphasized safety as a concern and set in place, but similarly they set in place time limits to prioritize permanency for children in foster care. So safety and permanency have been around for, in terms of policy and prioritizing and investing. Those 2 goals have gotten a lot more attention. Well-being of children in foster care and certainly of parents, you know, has not received nearly as much attention or investment as safety and permanency. But I will say it is something that is being looked at and is being considered at the federal level more and more, particularly from the youth and the child and youth perspective, but understanding what that is, how it might be measured, how government funds might support well-being. Those are things that there's a lot of interest in right now. Next slide, please. A little bit of background and context about child welfare funding. So states and the federal government share the funding for child welfare services. In some states, counties and local governments also contribute to this funding. The federal government provides approximately $7.6 billion annually through dedicated foster care. So this is Title 4E, that's the dedicated foster care funding, and then dedicated prevention funding for families is Title 4B. Those are two funding sources that are what you may have heard of as entitlements at the federal level that are for foster care. There are other federal funding sources that are used for child welfare services, but they are not dedicated specifically to child welfare. States have more flexibility to use them for other social services. And the Title 4E and Title 4B money goes from the federal government to states. For every $6 spent to maintain children in foster care, so how this might include housing, case management, medical, etc. That's the 4E money, the foster care money. Only $1 is available to invest in a wide array of services that prevent the need for foster care. So that's the 4B money. So you see the priorities of funding right there, 6 to 1. You can see what we're paying for is what we're getting. We're getting a whole lot of foster care and not a whole lot of prevention. And finally, just the major funding source for foster care, Title 4E, primarily pays for maintaining eligible children in licensed foster care rather than providing services for families before they may have contact with the system or after, so those reunification services. Eligibility for 4E is tied to a 17-year-old standard that no one can really explain and no one really thinks is reasonable. So it is a very outdated funding system that that needs people like you to help influence and explain what needs to be fixed and how it needs to be fixed. Next slide, please. There is a wide variation in states' share of funding. State and local dollars do not have the same restrictions as federal dollars, but there certainly are restrictions and limitations as well. In recent years, many states, as their budgets have been severely cut, they've cut funding for prevention programs and other reunification services and other services as well. Federal funding for prevention has remained flat. So as I mentioned earlier, it's widely recognized that something needs to change here. We need to be making smarter investments into what we know works. And so there's a tremendous opportunity for parents to help inform what vulnerable families need to prevent them from coming into foster care, or when they may have had children in foster care, what is needed to quickly, safely, and appropriately return them home. It's a great opportunity for you to help inform these conversations. So I'll just end quickly with what's trending now in child welfare policy nationally. So these are just a few of the things that we're seeing either at the federal level or in a number of states excuse me, getting a lot of attention. So at the federal level, the Administration for Children and Families, as I mentioned earlier, has taken a big interest in well-being, and has highlighted the importance of developing and investing in well-being of children. There's a rapidly growing array of evidence-based and evidence-informed interventions that can minimize trauma, and so the trauma connection with the well-being connection are things that a lot of people, researchers, funders, the government is certainly looking at and trying to understand better. Again, changing the way child welfare services are funded. This is getting a lot of attention. There's a lot of, there's general agreement that something's got to change, but what that change is and how we do it, there's still not agreement on how exactly that might play out. And so, you know, there's a lot of opportunity there. Title 4E waiver demonstrations, which you may have heard of, and that's just basically the 4E money that I referenced earlier. Some states are have approval to use their foster care money a little more flexibly than is usually permitted. Those are helping to inform what longer-term change might look like to the Title 4E funding stream. Alternative response or differential response, it's also called appropriate response in one state. That is a practice in several states that provides more prevention and intervention services. It steps away from the investigative route in most cases with the goal of keeping the family together safely. And then some other trending items that are getting increasingly more attention: child sex trafficking and that intersection with child welfare, education stability for children in foster care, mental health services for parents and for children, the overuse of psychotropic medication for children in foster care, and those are some other areas that are getting attention that in some states more than others, and all of those are getting attention at the federal level. Next slide, please. So I just want to end with what I hope will be the key takeaway for talking to your policy audience, and just sort of reiterating this. Denise did such a great job of providing us an example. So we really want to connect your experience to what helped you or your family, or what you wish had been available to you or your family, and why. Why did it make a difference? Why is this important to listen to? Why should someone care and pay attention and use their political capital to move or change whatever it is you're trying to communicate? So with that, I'd like to just thank you for sticking with us and open it up for questions. I think